Hello, my name is NiDajha Barnett. I'm here today to inform you of the different kinds of pain management used for childbirth, focusing on the two main kinds, intravenous and the epidural. Everyone knows birth is one of the most panicky experiences for women. The biggest worry for new mothers is, will it hurt? Many mothers don't realize that there are other different types of pain management that can be used during labor, and that the choice on which they want to choose is solely theirs to make. With makeup, there are plenty of different kinds of brands, even different ways of applying it, but there is one goal, to make you feel even more beautiful than you are. It's the same with pain management during childbirth. Different techniques with the same purpose, to make you as comfortable as possible while experiencing something as beautiful as childbirth. Let's start with a foundation, because you can't have a flawless face without foundation. The most common used medicine for pain management is the epidural. Epidural anesthesia is given through a small catheter in the back, strategically placed with a needle into the space between your spinal cord and the membrane surrounding it. This helps relieve birthing pains because when administered, it numbs the entire lower half of your body. IV medicine like remifentanil is different in the sense that it isn't given through your back. Instead, it's given through an IV in your arm. It doesn't numb your body, it just sedates you so that the pain is bearable. Now you ladies know what's after foundation. We have to cover up those dark circles from those sleepless nights when your little one decides to play soccer at bedtime. That's right, concealer is next. It's a very common thing to use concealer, just like epidurals are the most commonly used anesthesia during childbirth. At this time in your pregnancy, it probably feels like you're being bombarded with so many different benefits and risks when it comes to pain and epidurals. A woman by the name of Gail K. Wong did a 15-year study on how many complications came from using the epidural. She found out that out of 3,152 epidurals that were performed, only 24 major complications were identified. She also found out that the two most common complications were local skin infection and drug error, which can both be prevented. You're done with concealer. Let's move on to the next step. Let's get some life back into that face with some contour. Not many women contour because they have very defined features already. Some people are completely oblivious to the word contour. Same with intravenous medications. Not many people use them, but there are a lot of people who also don't know about them. An IV anesthesia, like remifentanil, is patient control so that you can control how much is being administered, instead of getting a continuous drip that could be harmful to you or your baby. There was a recent study done to see how giving a medicine through the IV instead of through the spine would affect the mother and the baby. The study showed that IV administered remifentanil was a safe drug to use and to relieve the pain of the childbirth. Let's move on to the last step, lipstick. But there are so many to choose from. This is easily compared to the fact that there are many different types of pain management. One source found that what may work for pain would be immersion in water, acupuncture, and massage. These methods have yet to be considered as a positively working alternate because not many studies have been done on it. But it's okay, just keep breathing. We're almost there. Still can't choose a color? Let's compare the biggest two that are in competition, epidurals and IV remifentanil. A recent study compared women with an epidural and women with the IV to be able to see the differences between the two and the effect they had on the women and the fetus. While the study progressed, 2 women out of the 39 tested, 20 of which had the epidural and 19 with the IV, switched from the IV to the epidural group, leaving only 37 to actually work with. When the medication is first administered, there was no significant pain differences. Moving forward, the pain scores were somewhat higher in the remifentanil group, but was soon reduced within the first hour of receiving the drug. The patients using remifentanil reported nausea and vomiting, but not too many of them had it, and the ones who did get it got anti-nausea medication. 3 of the 20 epidural patients experienced itching. In the conclusion of this study, the researchers found that both the IV medication and the epidural reduced pain effectively. The reduction in pain scores was also similar in the stages of labor known to be most painful. Maternal satisfaction scores were high in both categories. So, what does all this mean? It means that no matter what makeup you use, you'll still come out with a beautiful face. Same with medication. Either one is totally up to you to choose which one you want. Many women have switched from the IV to the epidural if they felt that the pain was unbearable. Some women like to be natural and they don't want anything to help them through, just like women who like to be free of makeup. It all depends on you. It is your decision. Thank you for attending my session today. I hope I have informed you enough on pain management that you can make your own decision on which to use. Any questions?